If you have lymphedema, then you probably know that there is a lot of contradicting information out there about lymphedema. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and a lymphedema therapist. And in this video, I'm going to bust 5 myths about lymphedema. This is the first of probably many videos to bust myths about lymphedema because there's so much incorrect information out there. So make sure that you subscribe to my channel so that you stay up to date on what's true and what's false about lymphedema and how to manage it. The first myth that we are busting today is that there is no treatment for lymphedema. This is false. Although there's no cure for lymphedema currently, that doesn't mean that there isn't any treatment. This is a manageable condition with proper care and the right healthcare team. Lymphedema is treated with complete decongestive therapy, which involves 4 primary factors. These are manual lymphatic drainage, compression, exercise, and self-care and skincare. To learn more about lymphedema treatment and what it entails, keep watching to the end of this video, and then I have a link at the end that goes to a video where I discuss all about those different types of treatment for lymphedema. While we're talking about treatment for lymphedema, let's go to myth number 2, which is that lymphedema should be treated with Lasix or fluid pills. These water pills are not going to cure lymphedema. Now, while this medication can be helpful with certain types of edema or swelling, they should not be used alone for a long time if you have lymphedema. If these medications are used for a long time, they can actually make your lymphedema worse. This is because these medications pull water out, right? It's a fluid pill, and that's what makes you pee so much more when you take them. It pulls all that fluid out. But even though it pulls the fluid out, it leaves behind the protein in that lymph fluid. Proteins love water, and so they pull more water in because you just got rid of all the water. So over time, the cycle worsens swelling and can cause issues like fibrosis or hardening of the tissues because those proteins are just sitting there, they're getting more inflamed, and it's causing a lot of issues with those tissues. So if your medical provider is telling you to only take Lasix or these water pills, talk with them about if you really need them or not, and make sure that you also talk with your lymphedema therapist. Again, these medications can be helpful for some edema, some swelling, but not for lymphedema long-term. All right, next up, we are busting the myth that lymphedema only develops in the first 2 to 5 years after cancer treatment. Although many cancer survivors are most likely to develop lymphedema in those first couple years after treatment, if you've had lymph nodes removed, you've had radiation, you're at risk for lymphedema lifelong. That is way beyond those first couple years after your treatment. So what this means is that lymphedema can develop even decades after your treatment. I've seen it happen. Now, this is not to scare you, but this is to make sure that you're aware of your risk and to make sure that you're monitoring for symptoms of lymphedema and doing what you can to decrease your risk for developing lymphedema or for making it worse. All right, on to myth number 4, which is you can't do anything to decrease your risk of developing lymphedema. So while there's no sure way to absolutely prevent lymphedema related to cancer, there are plenty of things that you can do to reduce your risk of developing lymphedema and reduce your risk of it getting worse or exacerbated. Just a couple tips include monitor for lymphedema and report any changes to your medical provider immediately. The earlier that lymphedema is detected and diagnosed, the easier that it is to treat. Next is avoid skin infections, burns, and injuries when you're able to. This is because with these types of injuries, the body sends extra fluid and white blood cells to help with protecting the body, but because the lymphatic system is compromised and damaged, it's not able to move that extra fluid out of that area. So if there's a buildup of fluid, then that can trigger or worsen your lymphedema. So make sure that you're wearing bug spray, sunblock, protective clothing, and treat any injuries immediately after they happen. Next, monitor for signs of cellulitis, which is an infection that happens just underneath the surface of the skin. This type of infection is common for those who have lymphedema, and so you want to make sure that you're monitoring for it. This is an urgent medical issue that you need to contact your medical provider about immediately. Signs and symptoms include redness in that area, pain, increased swelling, and the skin will feel warm. You might even feel flu-like symptoms if it's very severe. So if you notice any of these symptoms, again, talk with your medical provider, let them know, and they'll get you started on some antibiotics if it is a cellulitis infection. Next is stay active and get to or stay at a healthy weight. Talk to your healthcare provider about what a healthy weight is for you and how to safely start exercising. Now, speaking of exercise, let's jump to our last myth. And that last myth is you cannot lift heavy weights or exercise strenuously if you have lymphedema. Another myth busted. Research shows that progressive resistance training is not only safe if you have lymphedema, but it can also decrease swelling and symptoms associated with lymphedema and decrease your risk for developing lymphedema in the future. Now, that being said, it is important to progressively increase your resistance training and activity. You don't want to go from 0 to 100. That can overwhelm the lymphatic system and lead to increased swelling. So examples include you do a full day of spring cleaning and then you start to notice swelling in your arm. That's a lot of activity that you haven't been doing and your body's not able to compensate for that extra fluid load. That means that you are not going full speed ahead with your exercise routine. It's important to start slow and progressive. And if you can, work with a oncology physical or occupational therapist or an exercise trainer who has additional training in oncology care. Working with a specialist who has additional training in cancer rehab and lymphedema can progress you and challenge you appropriately. If you need help finding an oncology physical therapist or a certified lymphedema therapist, I do have links in the description below. Thank you for watching this video. I hope you found it helpful to debunk some of those myths about lymphedema. Please like this video and subscribe to my channel for more videos about lymphedema and how to manage it.